everybody. Happy 2024. My name's Stacy Menton. I'm a speech pathologist and singer, and I write a whole bunch about vocal wellness and vocal pathologies and how to take care of your voice on this blog. Today, I want to talk a little bit about something that's near and dear to my heart. A couple of years ago, I was diagnosed with something called Hypermobility Spectrum Disorder, or HSD. It goes in line with something called Ehlers-Danlos Syndrome. And there is some new evidence that voice issues are common in people with Ehlers-Danlos Syndrome, a specific type of Ehlers-Danlos Syndrome, and hypermobility spectrum disorder. And so today I thought I'd introduce what these disorders are, and then also talk a little bit about how the voice can be affected. So first of all, there are 13 different types of Ehlers-Danlos syndrome. We have the genetic marker for 12 of these, but the 13th type is the most common type. Since we don't have the genetic marker for this, it has to be diagnosed clinically, meaning through a checklist that a doctor fills out. Hypermobility spectrum disorders are similar in the fact that there's a lot of hypermobility, joint hypermobility, chronic pain, and, as it turns out, voice issues. The classification system for Ehlers-Danlos syndrome and hypermobility spectrum disorders was created in 2017, and it's used widely to diagnose hypermobile Ehlers-Danlos syndrome. Hypermobile Ehlers-Danlos syndrome requires that you meet a list of criteria, and the criteria are pretty strict right now because researchers are trying to figure out what the gene is that causes this disorder. It's a connective tissue disorder. It means your body doesn't produce collagen well. It's faulty, and so there's lots of extra bendiness that goes along with it, but it also means that your muscles are trying to make up for the structure that should be there that's not there because of that collagen, faulty collagen. It's not that you don't have collagen, it's just your body doesn't make it well. There's three specific criteria with a list of things under each of them. And if you meet enough of those criteria, you are diagnosed with hypermobile Ehlers-Danlos syndrome. If you meet 2 out of the 3 big criteria, then the diagnosis is hypermobile spectrum disorders. In the end, there's not a significant difference in how these are treated, assuming that you have hypermobile Ehlers-Danlos syndrome or hypermobility spectrum disorder. There's no cure for these disorders. There is treatment though, making sure that you have a physical therapist who understands Ehlers-Danlos syndrome is important. If you have voice issues, making sure you have a speech pathologist who understands Ehlers-Danlos syndrome is important. The criteria for hypermobile Ehlers-Danlos syndrome and hypermobility spectrum disorders aren't perfect, and hopefully we'll have a genetic marker soon so that we can determine if these are 2 different disorders or if they're the same disorder, and if they're 2 different disorders, then what's the genetic portion for hypermobility spectrum disorders. Regardless of the diagnosis of hypermobile Ehlers-Danlos syndrome or hypermobility spectrum disorders, there is some new research that's coming to light where we're finding that people with these disorders are more likely to have voice issues. In my practice, I have seen numerous patients with hypermobile EDS and HSD, and predominantly the diagnosis is muscle tension dysphonia, and I'll link the studies down below that demonstrated increased voice issues, and I'll also link to my post on muscle tension dysphonia. The important thing to remember here is that muscle tension dysphonia is usually because the subsystems of voicing are not aligned. And if you want to learn more about the subsystems of voicing, I'll put that in the comments below too. I've worked with a lot of patients with HEDS and HSD. The predominant diagnosis that I see in this population is muscle tension dysphonia. And I suspect that that's because the muscles are trying to make up for the instability in the area surrounding the voice box. And so the muscles try to make up for that lack of stability, and we end up using a lot of extra muscle, which is similar in the rest of our bodies. This causes pain with talking as well as vocal fatigue, and it can also cause a reduction in vocal quality. It's very important that you find a speech pathologist who is either, ideally, one who is very aware of these findings that patients with EDS and HSD are more likely to have voice issues, and that the treatment needs to be, well, honestly, we don't have a perfect treatment paradigm for patients with HSD and HEDS. It's something that I hope I get to help create in the near future. But in the meantime, finding somebody who's seen a lot of patients with HEDS or HSD could be helpful. At the very least, find a speech pathologist who's willing to listen and willing to do a little bit of research to figure out how to treat these patients. In my own practice, I have found that going really slowly and trying to cut up home exercise programs to be like really short, digestible episodes throughout the day has been really helpful for my patients and for myself with HEDS and HSD. So to sum things up, voice therapy is the treatment for most of my patients with HEDS and HSD. I'd say 99% of them. So finding a good voice therapist who is willing to at least listen about HEDS or HSD, maybe tell them to listen to this video if you think it was helpful for you. And if you have additional questions, please feel free to reach out through my website, staceymenton.com. Thanks for joining me today, and I look forward to seeing you next month.